Welcome to The Merge, where faith and mental health meet. Hosted by LynnDee Horne, a licensed counselor and owner of Narrow Gate Counseling Services. The Merge provides a biblical approach to mental health and navigating life's challenges. Join us as we explore practical, Christ-centered solutions for mental wellness, relationships, and spiritual growth.
Welcome to The Merge, where faith and mental health meet. I'm your host, LynnDee Horne. Our episode today is focused on faith, mental health, sleep, and diet. To jump into these topics is my guest, Lauri Powers. So Lauri has been practicing medicine for over 30 years. She is a PA who is certified in both primary care and psychiatry. She's also a certified culinary medicine specialist, which is the art of preventing and treating disease using food. Additionally, she has a certification in cognitive behavioral therapy for insomnia, which is a form of sleep therapy and evidence-based practice. It's great. I've heard a lot about it, a lot of good things. She also started, when she started her own practice called Sleep and Diet Restoration in June of 2022, in order to teach her patients how to eat and sleep in order to minimize the chronic use of medication, optimizing both their physical and mental wellness. And we are so excited to welcome you today, Lauri, to the program. Welcome to The Merge.
Thank you. I'm so excited to be here.
So, Lauri, I started out, I like to start out talking about my guest journey because I just love to see how God takes us from a starting point and then where we end up. Many times to our surprise. Sometimes we know it's coming. It just depends. But tell me a little bit about your path to becoming a PA.
Sure. So I was that nerdy kid when I was growing up. I used to freak out my siblings because I would grow mold in my closet by ordering those agar plates and scratching my fingernails. And I'd have the pink and the blue and the purple mold and, making tornadoes and bottles and things like that. So that I always knew I wanted to do something science-based, but I thought I wanted to be a vet when I was growing up.
Okay.
My best friend and I had a plan. But then I realized you had to put animals to sleep. And so that killed that plan. And so I went off to college, pre-med. But by my junior year, I realized that my 20s would be gone if I stayed on that track. And I wouldn't be able to have kids at a younger age, which is what I really wanted. So my roommate and I went to the speech pathology and audiology tract. So I actually graduated with a bachelor's in speech and audiology.
Okay.
But again, my senior year, I realized that I wanted more than that. I loved learning about speech and audiology, and I loved the ear, nose, and throat anatomy, but I wanted to know more. And I had been volunteering at a hospital all through college. I went to University of Florida, so this was Shands. And I met a PA, and I didn't know what a PA was. And it was earlier on. PAs were, we started in the 60s, so this would have been in the 80s. So PAs hadn't been around that long yet.
Yeah.
So I found out what it was, and it kind of encompassed all the things I wanted to do without having to be 30 years old by the time I could start a practice. And so I had already had all the pre-med classes, and I took my GRE because I was trying to get into graduate school for speech pathology and audiology, and so I was able to apply, and I got right in. So that was a God thing for me. So I attended Duke. So that's what happened.
Awesome.
So that was in the 80s. And take it forward a little bit, I did primary care for about 10 years and psychiatry for about 24 years. And while I was doing psychiatry, I went to Psych Congress, which is a psychiatric conference, and they recommended that all the psychiatrists go back to school to study culinary medicine, like you explained, which is the art of preventing and treating disease using food, and they wanted us to treat mood with food.
Wow.
And so I started doing that, and I had such success with that, but not just psychologically, physically. All my patients were getting well. But the only thing that food doesn't really help is sleep. So I went back to school again over COVID, online this time. And I studied I got certified in cognitive behavioral therapy for insomnia, which is literally teaching people to sleep. And I also screen and treat sleep apnea as well, since I'm a medical provider. So I do all that.
Wow.
Yep, so that's how I got here.
A couple things I want to point out there. So you ended up starting on the med track and then realizing that didn't really line up with the other goals that you wanted in life of family and being a mom and that kind of thing. So you made an adjustment there.
Right.
Well, then you get your bachelor's degree and then you're in that but realize that you want to do something else. And I love pointing that out because I think sometimes One of my best friends went and got her master's in counseling, and she never used it. She doesn't think that she went on the wrong path with that, but God ended up taking her into a completely different field.
Right.
And so I love how we get these credentials or these degrees, and sometimes that isn't necessarily what we end up doing, but God can use that as a launching pad or a direction to show us on where we can go next.
Yeah, and I've used every bit of it. I mean, even though I was speech and audiology, there's an incredible focus on anatomy and physiology when you're studying speech and audiology. And so I wound up going into ENT my first 5 years, and I used every bit of that. And I worked well with the audiologist and the speech pathologist because I understood much better than a traditional medical provider without that training. So yeah, I've used all of my training. God has made sure I used it all every step of the way. So
that's awesome. I love that. Some people kind of know when they're in, or they hear God say, I want you to go this direction. Were you kind of there, or were you kind of praying along and like, Lord, I don't know? Like, what was that journey like for you, career, and kind of having that conversation with God?
Well, I wasn't a Christian initially.
Okay.
Yeah, so I didn't become a Christian until I was in probably late 20s, early 30s. So by then I was already a mother, married. You know, like my journey was a little bit different. So the early years of me being a PA, I wasn't a Christian. And that, we could do a whole podcast on how that happened, because that's a whole separate story, a really long one too. But actually, maybe I should touch on it. God definitely used my career bringing me to him. I had three different occasions over my practice prior to and even after becoming a Christian, where God sent me patients, and they literally said, and I'm not lying to you, when I walked in the room, why are you here? I don't know. God told me to come. There's nothing wrong with me. And I literally, some of them handed me or quoted me Bible verses, stuck them in my pocket, prayed over me without me having to document something in a record, because you're in medicine and we had to find something to look at in their ear and once was an urgent care. I'm not kidding. So so God's definitely used my career to bring me towards him and to help me in hard times.
Wow, that is, so he sent you. Mm-hmm. He sent you people.
And I'm not even sure if they're real people to this day. Like,
who knows? Mm-hmm. Wow, that is crazy. So I love that. Yes, that's a great story. So what, you were in traditional medicine for 30 years. You specialized in psychiatry. As you look back over time, because I definitely feel this way going from a more secular counselor that's a Christian to doing the biblical counseling that I do now, right? There was a shift a little bit in all of that. Like, what do you appreciate about traditional medicine, and what were your concerns along the way that kind of shifted you to where you are now?
Okay. So I've always been kind of a tree hugger, grew up in Daytona Beach, Florida mostly, but in the country, believe it or not, with horses and chickens. And, I was an outside girl. Not the beach type of outside girl, but the animal type of outside girl, dogs and cats. Long story short, I studied traditional medicine not knowing what that would be like. No one in my family had gone to college, or no one was a medical provider. Like, I didn't know what that would look like. I just knew that I liked the idea of healing. And my grandmother was a huge influence on me because she was very much like me. She ate well, she exercised, she believed in getting outside and touching the earth and growing things, and she believed in sunshine. So she to this day still has a powerful influence on me. But I didn't realize that when I got into a medical program that they wouldn't talk about any of that. Yeah. That nutrition and lifestyle are literally not taught. Even at Duke University, which is a fabulous university, it's just not taught. And so, but what they do teach, and they teach well, is to how to do an incredible history and how to do an incredible physical, and to take that information and to make a diagnosis and to make a treatment plan. But that's where it ends. So the treatment plan is medication or a procedure or surgery. And I didn't know that. I didn't know that we wouldn't learn those other things. And so I went off and I did my primary care, my ENT and primary care, and then I went off and went into psychiatry, really using that same model, but understanding that I wasn't really making people well. I was putting on a lot of Band-Aids. Now, the American system is great if you need surgery. It's the best if you have an emergency. But as far as prevention and how to be well and how to avoid medication, we're not good at that.
Yeah.
So that's the good and bad of the system to me.
Yeah. And so you said you were at a psychiatry conference and they were telling you, hey, go back and get this culinary. I mean, so psychiatry seemed to at least look and say, hey, we're maybe not missing it, but we're ignoring this huge part of mood and food.
Well, I would say that most, and I've done medical conferences, I mean, when you're certified in multiple things, you're constantly having to get continuing medical education. So I have 3 different certifications that require 3 different sets of educational hours regularly, like 50 hours or more a year. So I go to a lot of conferences. Most of the conferences will touch on here and there a little bit of lifestyle, but they're usually the optional hours. You don't have to go to those. You can choose the medication hours if you prefer to do that, right? So I would always look for the conferences that were more lifestyle medicine-like, and Psych Congress is one of those. They offer the most lifestyle medicine hours compared to any other psychiatric conference that I'd ever been to. So that was by my choice, right? So I don't necessarily think that psychiatry is more interested in lifestyle than the medical world. I think I just lean that way, and so I choose those conferences. Yeah. So I chose that particular conference and that particular hour. So you can choose your different CME hours. I chose that hour, and that's what it was telling us to do. So that fit with my passion, that fit with what I thought medicine was going to be like. And it's a 2.5-year program through Tulane, and this was before COVID. So I had to go fly back and forth several times to take cooking classes with culinary medicine specialists that were doctors, and it was so powerful. And then a lot of it was online, and then there was a certification exam. So to me, it took about 2.5 years. But that was, again, right before COVID.
Yeah.
Yeah. Thank God.
We may get into this later, but I'm going to go there now anyways. For me, like I've just, I'm going to say more recently, been on the train of understanding. I know that food can heal our bodies. But what I have been even more interested in is this place of God created this world with so many of the things that we need that we overlook. And so when I think about food as medicine, I'm just like, God already made the food. He already made it. So in that, like, in that like culinary specialization, like how do you see God in that, or what does that show you about God?
So, well, most of my patients have a Judeo-Christian background of some sort, even if they're not claiming to be Christians, and all of them have heard of Adam and Eve. So I actually do use that analogy unless it's offensive. And I just explain to them that my belief in my lifestyle medicine practice, which is what I call it because it encompasses all, is the Garden of Eden. And so if you go back to the beginning, God literally gave us every single thing we needed. He took those baby humans and he put them in the perfect conditions. So what were those conditions, right? Everything was grown. Everything was organic before we had a word. Yeah. Everything was single ingredient, which is so key. There were no pesticides, preservatives, food dyes, colorings, additives, fillers, none of that. So that was number one, just looking at the food, right? But then you look at, they were close to the equator, and they were naked and barefooted. So they were grounding, they were getting vitamin D on their skin, they were getting perfect air and perfect water because we hadn't come along to destroy the water and the air yet, right? They had each other and then they had children. So they socialized and they walked with God. And they had animals. They had it all.
Yeah.
Right? So they literally had every component of wellness and fitness. They didn't have cars. They had to move their bodies. And that is what I try to bring people back to. Like, that is my passion. Like, and even what my grandmother taught me, like, get back to that. She was Italian. She was from Italy. And that is more what you see there than in the States.
Yeah, absolutely. That is such a good picture. Thank you for sharing that with us. Okay. So you've started this practice in June of 22. When did you know it was time to start and kind of leap out and have your own business in that way?
COVID was so hard on medical providers. It whipped me. So when COVID happened, I was actually in a local pediatric office, but I wasn't doing primary care. I was doing behavioral health. Okay. So that provider had hired me and said, I want to have a simple behavioral health practice. So he didn't want, very sick children. He wanted mostly ADHD and minor problems. And I told him, wow, that's hard to do. And as a therapist, you would know that too, LynnDee, right? And I told him, he said, my providers will screen everyone and you'll get the healthiest of the healthy. And you can just be our behavioral health provider here. And it's a very large practice. And so that worked out okay initially. But then what happened was COVID came. And with COVID came lockdowns and lack of education, and some kids that were suddenly latchkey kids and other kids that were suddenly home with maybe abusive parents, or some kids that didn't have food because they were getting their food at schools. Many kids were failing. And so all of a sudden my healthy ADHD kids were suicidal. They were having all kinds of problems. And guess what? The therapists were slammed.
Yeah.
The hospitals were slammed, the psychiatric hospitals. And so now I was balancing really sick kids during a very, very stressful time. So I left that practice, and I had studied cognitive behavioral therapy for insomnia. So I actually worked at a sleep clinic for a year. It's still over COVID. So it was mostly very stressful. I actually worked out of a supply closet.
Oh my goodness.
It was crazy, doing a lot of telehealth. And eventually I decided, you know what? I need to do and put it all together. I need to do lifestyle medicine. What made us so sick over COVID was lack of lifestyle medicine. In other words, the fact that no one was taught how to be well. And then this perfect storm came along and everyone was so sick. And so I decided to start my own practice. And I won't go into this either, but I'm also very anti-COVID vaccine, and that was a big part of it too.
Gotcha.
Yeah.
Gotcha. Yeah, and I think the other thing, like you just said with lifestyle medicine, the other thing that I saw was this shift on, there had been a reliance, whether healthy or not, on certain structures to keep well-behaved children, or to keep this or to keep that. And then all of a sudden those structures
Collapsed.
are taken away.
Oh, they were gone.
And then what do you do? So there was so much floundering in several different areas because of that, which, like you said, COVID was hard on everybody, but COVID is actually when narrow gate counseling was birthed as well. So
crazy, right? We both started our practice.
We had to pivot, and God was saying, all right, it's time. It's time to launch. So how were you taught and trained to conceptualize mental health specifically?
So when I was at Duke, behavioral health was a teeny tiny part of the curriculum. And, think about this. This is in the 80s.
Right.
And everything was so different back then. So there wasn't a lot of emphasis on behavioral health. We learned the basics, and that was about it. We had a simple rotation, and that was that. I was in primary care for a number of years, and obviously in primary care, you're getting some of that as well. So you're seeing some depression, some anxiety, that type of thing. Well, eventually I wound my way into psychiatry through primary care, because I started admitting psychiatric patients for the hospital. That was how I started in psychiatry. And one of the doctors there liked what I was doing so much, liked my work, that he asked me to work with him. And I actually, this is crazy, but I got trained for an entire year with a child psychiatrist. He literally spent an entire year with me, while almost as if I was a resident, where I wasn't really seeing my own patients, and taught me child psychiatry. He had quite a lifestyle medicine bent compared to the others as well. So that was very influential on me. But psychiatry is similar to primary care, where all of medicine actually, where there's a book, just like there are medical books, that you match symptoms and create a diagnosis, and there comes a treatment plan. But it's a little scarier in psychiatry because there's not a lot of imaging or labs, so it's really based on symptomatology. And so I learned how to do that very well, but I was back to the same problem. Now mostly my other than therapy, which we referred all of our patients to therapy because I worked at the mental health center for a long time, so we had the sickest of sick.
Yeah.
Everyone had a therapist, but the only other thing in my arsenal was medication. Yeah. And so I knew a lot about lifestyle medicine just from my own passion and my own interest, even though I didn't quite have the tools in my toolbox yet, because I hadn't studied culinary medicine or sleep therapy yet. But I was known for being the provider that avoided medication, tried to get people off medicines, weaned off medicines, would try things that other people wouldn't try, because I knew that these medicines were so unhealthy, and we were mixing crazy number of medications and really high doses, even in young 3-year-old
giving
children.
them to very young children.
Yes, and I knew. But the teachers would expect it. The parents would expect it. It was, our society was expecting the children to conform. And a lot of that is lifestyle problems. They're not getting PE like they used to. They're not getting outside after school because they're latchkey or because their community is not safe. They're not getting real food. So going back and teaching some of the basics to these parents is so important to me.
Yeah. because the knowledge just isn't there on
right.
how impactful it really is.
Yeah, and it's actually cheaper to eat healthy than, I'm sorry, I could teach you how to go to Aldi's all day long, which is our cheapest.
We may need to have a podcast on that too.
Yeah, it can be cheaper to eat healthy than it is to eat the standard American diet if you don't combine the two. Most people don't do that. They combine the two. They're getting the healthy foods and they're getting the junk food and they're eating fast food. That's not cheaper. But if you commit to eating healthier, I shop at Aldi's. I could teach you how to do it. My grocery stores, grocery bills, way less.
Wow.
Yeah.
Well, that's encouraging.
Mm-hmm. Yeah.
So I think we're at a good place there. Let's take a break, and then we'll be back and continue to jump into all of this great information. So you are listening to The Merge, where faith and mental health meet, and we will be right back.
Narrow Gate Counseling, providing professional counseling where you are. At home, at work, or on the go. Our virtual counseling services are convenient, affordable, and accessible on any device. For a free consultation, call 888-9-NARROW. That's 888-962-7769. Connect and learn more now at narrowgatecounseling.com.
Welcome back to The Merge, where faith and mental health meet. I'm your host, LynnDee Horne, and I'm here talking today with Lauri Powers, who is a physician, a PA, physician associate. Is that what it is?
Well, now it's associate. Yes.
Now it's associate. Okay. But she has over 30 years of experience and currently has her own lifestyle medicine practice called Sleep and Diet Restoration. So we have talked a little bit about traditional medicine and jumped into some food and a lot of good information. So let's keep going. So you've already mentioned a little bit about faith and how your initial journey wasn't necessarily around that because you came to faith when you were older. But now, how does faith really influence the way that you approach mental health and just overall well-being?
So I would say my average day, and I think the older I get, especially through COVID and now being a grandmother, the more important this is to me. But my average day, I start my day out. Because I get enough sleep, a lot of times I'm awake before my alarm. But even if my alarm wakes me up, my first 15 or 20 minutes, I just lay in bed and pray. So that's how I try to start my day. And then from there, I go make a healthy breakfast, and I sit down, and I usually read the Bible while I'm having my breakfast, even if it's just a few lines, depending on the day.
Yeah.
So I try to merge my healthy living or my healthy lifestyle with my faith. I literally pray throughout the day anyway, like in the shower, wherever I am, different thoughts come up. And then through the day, I get to work. Another healthy thing that I might do would be I turn on relaxing music. I love essential oils, so I have a diffuser. And the way that I stay kind of active at work, since I have a really sedentary job, sitting, I don't use fluorescent lights for one, but I have a standing desk and I have a bike that goes underneath my desk. So I do probably 30 or 40% telehealth still with COVID and patients that are in Raleigh or Charlotte or other places, the mountains. And so I tend to either stand or bike when I'm on a telehealth call. And then after work, I go home and cook another healthy meal, spend time with my husband, and then I like to take my dog for a really long walk, like a good hour, and I talk to family and friends on the phone usually when I'm doing that or listen to great podcasts. And then when I get back from that, my favorite thing to do is I take an Epsom salt bath every night, usually with some lavender oil, and I typically would read a book to relax. So that's kind of my day.
Just your rhythm,
yeah,
right?
That's just kind of my
life.
rhythm, and how to be, just to keep myself well and to keep myself sane and to keep myself kind of in touch with what's important to me, my family, my friends, God, my pets, things like that.
Gotcha. Okay. Yeah, I love that. So you kind of talked about what some of your daily habits would be. What about are there other weekly habits that you would add to care for your mental health or just your body or any of that?
Yeah, well, we go to church every week, so I would say that that's pretty standard unless it's a strange week or we're out of town. My husband and I like to have date nights regularly and always would have weekends away, even when our kids were growing up. And I can't tell my young married families how important that is, quarterly, to get away for an entire weekend and just relax with your spouse. And even though our kids are long grown and gone, we still do that. And actually this year, for the first time, we went away for an entire week. Just, yeah, we never do that. That was so great. We went to the beach for an entire week, just the two of us. Normally it would always be with family or visiting family. We just went, the two of us, and it was lovely. It was one of my favorite vacations ever. But other than that, I see a chiropractor once a month. I've always gone to the chiropractor for scoliosis. And
Same, yes.
Yeah, and I love my chiropractor, and I get a massage once a month. So those are, and I try to balance stretching and weightlifting at night. So after I go for a walk, I usually either do some weights or some stretching. So that's pretty much also kind of a daily thing that I do. So that's probably the main things that I do.
Gotcha.
Not on a daily basis.
For the, I'm just sitting here thinking about the mom with 4 little ones at home or different things like that, trying to figure out what a healthy rhythm would look like or where to even start with that. If they're going to get, and you may even tell me this is not the way to look at this, which is fine. I'll take that. But if they're going to get like the biggest bang for their buck, or what could be something that would be really intentional if they were just trying to do it, because we're talking about biblical rhythms here. We're talking about lifestyle. We're talking about this is what we do weekly or monthly or daily. What are some just small, what would you suggest? Where would you start?
The most important thing for working moms, especially with children, or just stay-at-home moms, homeschooling moms with, multiple kids, is meal planning and meal prepping. So even now, and again, my kids are grown and gone, I have my grandchildren like every other weekend and on Wednesdays, so Wednesdays is my day off. So I'm still pretty busy with kids, and I don't want to do all the housework with the kids. I'd rather spend time with the kids, and I have that luxury because I'm the grandmother, right? Yeah. So even now, I do most of my grocery shopping, and when I grocery shop, it's a big deal because I know how to clean the produce, and so that's a time-consuming thing. I clean all my produce. And I have, I go to the grocery store with a list, and I usually have 2 large meals that I'm going to make. And then we eat through the week on those meals and making them in different ways, maybe taking rice and beans and making a wrap, or maybe the rice is on the side with a different vegetable. Every night we'll have rice for several days. Every night we might have beans in a different way. But that's how we eat. And then we usually go out to eat Friday nights. And so that's another way to keep it cheap, right, is to eat the same basic foods, cook all of it at once, so you're not cooking, cleaning. And my husband doesn't mind. Like, he's perfectly happy with leftovers. I know a lot of men don't like leftovers, but you can always fix them up. Take those beans, throw them in a pot and with some soup. You can change what you do with the food so that the other person is more interested in eating that. But that's what I recommend. If you have kids, don't cook every night. It's exhausting. And what will happen is you'll wind up going to McDonald's, right?
Yeah.
And so, but you only need 5, maybe 10 recipes all together, and you can mix and match and just cook 2 a week, but make a large amount when you cook.
So that to me sounds like, especially if someone didn't grow up where they had a lot of cooking happen in the home or things like that, it really sounds like skills acquisition to me.
Right.
In a lot of ways.
Right.
Are there certain programs that you point people to, or websites, or just how you teach them a certain structure to be able to do that?
Well, it depends on the person. So it depends on their socioeconomics. A lot of it is cultural. So I have a lot of Hispanic families, and what they eat, it might be different than what you might eat. It depends on their medical problems. And I always ask the spouse's medical problems as well, because if I change the wife's what she's cooking and eating, it's going to change the husband. Mm-hmm. So if he has insulin-dependent diabetes or hypertension and he's on medication, I need to know that because I don't want to crash his blood sugar or his blood pressure. So what I do is not necessarily just sending people to websites. I have some specific recipes, but I basically talk them through how to take their favorite recipes and up the game. Make it healthier, make sure that what they're already eating is okay for everyone's medical problems, and then kind of add to that and teach them how to grocery shop and add to that, and understand I don't believe in counting calories. I don't count macros. I don't count carbs unless you're insulin-dependent diabetic. None of that. I just want to understand how many food groups are you eating in all the food groups, and where is that sourced from, and what's the quality, and what else is in that, and how can we make that better for you, easier for you, and something that you love. Because if you don't love it, it's a diet, and diets have beginnings and ends, and I don't believe in diets.
Yeah. Gotcha.
Yeah. It's got to be a lifestyle. It's got to be a lifestyle.
It's so different. We talk about that a lot in counseling too. It's like we can make these changes now, but it needs to be something that's going to last.
Right.
Or
yeah.
Or the effectiveness is going to go away.
Yeah. Yeah. There's no point.
Yeah. So again, this is just taking me somewhere else. I think one thing that frustrates me from the counseling world, while there's information at our fingertips, there's also a lot of misinformation at our fingertips.
So exhausting.
So, you know, when you're in a field and you're trying to get the right education out there, or I just see a lot of like gimmicks, or even from a food standpoint, this is a good food, this is a bad food, or just really, and some of that makes sense, right? But some of it, like when somebody calls fruit maybe necessarily a bad food, but these, you know, this diet over here is telling you to eat it, or this way of eating.
Yeah.
There can be a lot to weed through there. And I think, unfortunately, social media has made that
so much worse.
Worse.
That is literally one of the reasons I wanted to go back to culinary medicine school, because even I didn't know. Remember, medical providers are taught almost nothing about nutrition.
Yeah.
Even cardiologists, even endocrinologists that treat diabetes and heart disease, they'll admit to you, they really were taught almost nothing. So I wanted to go back to learn the truth about that as well. And what I tell my patients is follow the money. So the people that are trying to get you to buy their book, buy their diet, buy their protein powder, buy their supplement, follow the money. Because the cheapest diets are the healthiest diets. So think about the blue zones, the people that live the longest in the world. What do they eat? Beans and rice and some vegetables. It doesn't have to be complicated. Maybe a piece of fish, maybe a simple piece of meat. But meat is not the center of their diet. And meat is the expensive thing, right? And this whole protein fad, where eat more protein, super hard on your liver and kidneys. 97% of people are getting too much protein, and tons of people are making a ton of money off of it. So the protein shakes are all sold by Nestle, Coca-Cola, Big Pharma. They're making a ton of money off making you think that you need the protein, but they're also not made from God, those protein shakes. I do not recommend them.
Yeah.
Yeah. So teaching people how to eat affordably, from the earth, clean, one ingredient, and understanding the ratio of fat to carbs and all of that. Understanding that ratio is the most important thing.
So I'm assuming here, but probably a lot of your practice really is that education piece.
I'm a
coaching
teacher.
them through that. Yeah, you're such an educator.
I'm a teacher. Yep. And what I tell them too is, if you want to lose weight quickly, you can go on any diet you want. That's not why you're seeing me. We're not here for a quick fix. But any diet works because it takes something away. But it always has a beginning and an end, and most people can't stay on those diets forever. And I know we're not here to talk about Ozempic and Wegovy and all the medications.
We can go there. We can go there.
Yeah, but you can't stay on those forever either.
No.
And statistically, people don't. Even though now they're saying you can, you shouldn't. 50% of every pound you lose is a muscle. Is a muscle loss. And guess what happens when you lose muscle? You get frail, you get weaker, you fall, but it also slows your metabolism, so you can't go off those medications.
Against,
And then when you go off, you have huge rebounds. So a lot of the patients that I see have failed those medications. And occasionally I get some that are still on them, and that's okay, because I want to teach them how to eat so they can ever get off of them. But then we add some serious weight training so that they don't lose the muscle, so that they can ever get off them and be successful. So I'm really passionate about that.
Yeah. I love.
But I won't prescribe them, and I do get phone calls, so don't ask me.
Okay, you've heard it here. Yeah. So if you were to just share with us maybe a few ways that our diet or our gut, I know, is connected to our mental and emotional health. Like, will you teach us for a minute or educate us on how those things are connected?
Yeah. So when back in the 80s when I was in school, we didn't even know what the gut biome was. Yeah. Right? And so I am so fascinated about the gut biome. It is literally another organ that I was never taught about. And I'm so passionate to continue to learn more about that. But we are literally more bacteria than we are human when you look at us on a cellular level. And we have a war going on in our gut all the time between our good and our bad gut bacteria. And there are so many ways that we are damaging our good gut bacteria. So one way that we're damaging them is that their food, what they eat, is fiber. That is what they eat. One ingredient fiber, not processed white junky carbs. One ingredient fiber, like oatmeal, like brown rice, like quinoa, like corn. But most people are not eating that, especially women, because they're terrified of carbs. Okay? Beans. People in America don't eat enough beans. So because we're not eating those, we're not feeding our good gut bacteria, number one. Okay? Number two, we're killing them all the time. How are we killing them? We can kill them by taking antibiotics. But we can also kill them by alcohol, even mouthwashes, because our gut biome starts in our mouth. We can kill them by eating processed foods, especially with artificial sweeteners, right? So we're killing them all the time. And then what are we doing? We're feeding the bad guys. And what do they want? All the junk. And where do the neurotransmitters live? Where do the neurotransmitters live for our mood, like serotonin? In our gut. And so all of that is affecting our mood. And the heavier we are, the more we're making estrogen, and that as women affects our mood as well. So it's really important that people understand that we literally are what we eat. And when we make our good gut bacteria happy, we feel so much better. Part of that is losing weight, but part of that is eating the right foods and not eating the wrong foods. And then sleep comes into play there as well, because your good gut bacteria need 12 hours of sleep at night. I know that sounds crazy, but I try
Really?
Yes, I try
did
to
not know
put
that.
them to bed and let them, every time you eat, they have to work. Every single time you eat. So you need to let them rest so that they can multiply and do the best job for you so that you can be physically and mentally healthy. So unless you're really hungry, try not to eat. And it's not hard to have a 12-hour fast.
Yeah.
So don't eat after dinner until breakfast. Unless you're really hungry, then have a piece of fruit or something easy to digest, not a big meal, right? And that also helps your sleep. And when you sleep better, that's when your body repairs. And so all of it goes together. There's healing, there's anti-inflammation, there's growth hormone, which is released in our sleep, which is our natural morphine, right? So when we sleep well, we feel better, our gut is better, and it's a huge circle of life. And that's why I wanted to do both together.
Yeah. When you started learning all this, did you overhaul your own life, or were you already?
Oh, no. Yeah, I thought it, like you, I thought I was healthy, right? And I studied culinary medicine, and I came home and started throwing all my food away. And my husband was like, "What are you doing?" And I'm like, "Listen, I cooked for you and the family for 20 plus years, and now I'm going to cook for me. You can add whatever you want. You can eat out at lunch, but this is how I'm cooking." He's been so supportive. He loves it. He feels so much better.
I was about to say, he probably has had good results from that.
Yeah, well, he was also, he's an athlete, and he was relatively, he's a thin person. He was relatively healthy, but he did have high cholesterol, and he was on medication that inflamed his liver, and I got him off of that, and he just feels good. He looks around at his friends, and he's like, "I look pretty good. I feel good." So, I think he was really, really happy about that. My kids love to make fun of me, but they also tell me things like, "Thanks for teaching me how to be healthy," And I know my son and daughter-in-law appreciate that the grandkids are fed healthy, and they never have to worry about that at my house. Right. So
there's a lot of people that when the kids go to their grandparents, you just know everything is about to be turned upside down because they're going to get.
And they get sick. Then they get sick after that because it lowers your immune system, And so that doesn't happen at my house. So, I think that it's spilled over in a lot of positive ways. And I'm not perfect. Nobody's perfect. I definitely have days when I don't eat as well as other days. But I'm motivated every single day because when I don't eat well, I feel sick. And I'm so in tune with my body that it literally just takes a few bites of something for me to go, ugh, my stomach is like, I can't do this. Too much sugar, too much fat, too many chemicals, pesticides, whatever's in it. Can't do it.
And it's interesting for me, when I've really gone through clean eating or I've done fasting or there's been something that I've done and then I try to go back and eat a certain food.
Yeah, can't.
I can taste the chemicals or taste the fake.
Like a cupcake
when I
or something.
could not do that before.
I know.
Before it tasted good. And I'm like, this is horrible. Mm-hmm. But it's because I've actually cleansed my system.
Exactly. It only takes a few weeks to get new taste buds. That's the beauty of that. So once you get new taste buds, they're offended by too much sugar, fat, or salt because we were not built to eat that much. Think about it. Early humans had to work to find fat, salt, and sugar. It wasn't put together in any place in nature. In Garden of Eden, they didn't find that. So when we find it, from a standpoint of, ooh, yay, we found it all in one place, our body craves it because it thinks we don't have to work for it. But it also doesn't feel good because it's too much. So when we eat it, we feel bad, physically and mentally, right? And once I can get people to make that connection, that's the key. Once they figure that out, they don't want to eat like that anymore. And that's how they maintain it. And that's how I maintain it. Yeah.
Just because you feel so much
I feel so much better. Because I feel like I'm 15. When I'm around teenagers, I'm like, am I not their age? Because I feel their age. I have to go, no, you're not their age. You remember when, tie-dye and different, neon in the 80s. No, you're not their age. But I feel like that. And I want to always feel like that. As long as I'm here, I want to be able to do everything God wants me to do. That's, and I'm ready to go tomorrow if God wants me to go. But I want to feel this good until I can.
Well, and that gives... I hope what people hear in that statement is hope, because if you're I'm in my 40s right now, and I've been dealing with a sluggishness that I have never felt in my life before, and I'm doing some research on where that's coming from and what I need to change. Maybe I need to book an appointment with you to learn more about that.
Insurances. Yeah.
But I think there's this place sometimes where we get where I don't know if this can change back, or this is just age, or this is just expected to decrease in this area. And what I'm hearing you say is that's not necessarily true.
It's not age. Oh, no.
Yeah.
I have a ton of patients in their 80s that feel as good as I do after seeing me for a while. Yeah. No. It's definitely not age. I had a woman come to me crippled in a wheelchair with rheumatoid arthritis. And now she's out of her wheelchair, up and about. Even though her joints are crippled because there are physical changes, the inflammation is gone. And she even tried it by going back to her old diet, and all the pain came back. I mean, it is so powerful what food can do. Like, God knew exactly what he was doing with the foods that he gave us. But we've just gone so far away from them, right? And don't forget about spices. Spices are plants. They're super powerful and very anti-inflammatory. If you get a clean source, I usually try to buy organic spices. They're very, very healthy.
If we should add one spice or two, or however many, like, to our cabinets and cook with it, what would that be?
If it's savory, I like turmeric and cumin. If it's sweet, and this is what I add to my oatmeal almost every morning, it would be cinnamon, clove, and ginger. Okay. And then chocolate, dark chocolate. I also buy organic 100% dark chocolate and add it to all my fruit, like bananas, apples, pineapple. Just like I put it in what you would use to sprinkle powdered sugar. Like you can get those at Hobby Lobby. Mm-hmm. Put your dark chocolate in there. You can sprinkle it on anything sweet, even your oatmeal too.
I didn't even think about that.
Yeah, because I love chocolate. Yeah.
Same.
It's super anti-inflammatory. It's a bean.
True.
The cocoa bean. Yeah. It's just what we add to it that makes it not so healthy. Right?
Yeah. Yeah, all the sugar
but
and
the
all
fruit,
the other stuff.
the natural fruit sweetness, like especially a really ripe banana or some pineapple, it's delicious with dark chocolate.
Yeah, I like cocoa powder. No, that's a great idea. I'm going to do that more. I've done that with like making homemade desserts before, like using a banana and then adding the cocoa. So that's the sweet. Mm-hmm. But
it's just quick and dirty. You can just I literally have all those spices I just listed on my counter all the time. Like people keep salt and pepper.
Okay.
So I never forget to use them. Like when, a little bit on the rice, a little bit on the vegetables. Just kind of add them.
Don't hide them in the cabinet. Keep them out.
Yeah.
You can just use them.
If you like them. Yeah, keep them out.
Okay. Mm-hmm. Great. And I know that, like you just mentioned inflammation, but I know like turmeric and all of those are good with inflammation. And that like I know that part. That's about all I know in that area. So we're actually at a place where it's time for another break. So let's take that, and we'll be right back. You're listening to The Merge, where faith and mental health meet. We'll see you in a second.
Narrow Gate Counseling, providing professional counseling where you are. At home, at work, or on the go. Our virtual counseling services are convenient, affordable, and accessible on any device. For a free consultation, call 888-9-NARROW. That's 888-962-7769. Connect and learn more now at narrowgatecounseling.com.
Welcome back to The Merge, where faith and mental health meet. I'm your host, LynnDee Horne, and I'm here today talking to Lauri Powers about diet and sleep and just all of these wonderful things that we have been talking about so far. I highly recommend going back and listening. I'm learning as anybody else would be, I think, listening to all of the stuff today. So let's get a little bit more into sleep. We've talked about diet. We've talked about food a lot. So as we wrap up, like how... You've already mentioned that our body needs to rest our microbiome, but how important is sleep to our overall well-being?
If you go back and look at history, so I'm also a history buff, and I love historical fiction, history, and the wars and all that. That's how we've traditionally tortured people, is by not allowing them to sleep.
That's a great point.
So not sleeping is a really big deal for your gut biome, for your mental health, for your physical health. I mentioned briefly, especially for pain, I tell my patients, if you have pain and you're not sleeping, you'll never get a handle on your pain without a lot of medication, because your growth hormone is released when you're sleeping, and that is your pain reliever, your natural God-given pain reliever. So sleep is so important. And one thing that I've learned in possibly because maybe the training wasn't as robust back in the 80s because obesity wasn't such a problem. But most providers know nothing about sleep apnea. They're starting to teach the dentists now. It's so interesting because they see a lot of changes orally, but the traditional medical doctors, most of them don't order sleep studies and don't screen their patients for sleep apnea. And unfortunately, we need to start from childhood. Like there's so much obesity now, but even for tonsils and adenoids and things like that, all these kids should be screened for sleep apnea. It's not normal to have a child that snores unless they're having a cold. Okay? And so if your child snores and they are not sick, you need to at least talk to your pediatrician about that because it likely could be a symptom of sleep apnea. An adult can have some snoring, but it shouldn't be moderate or severe, and it shouldn't be consistent. And you can also have sleep apnea without any snoring at all. So if you're overweight or obese or you have hypertension and you don't know why, like there's a whole list of questions that we ask to screen for sleep apnea.
And that's when you stop breathing during your sleep,
Yeah,
right?
you pause
Okay.
and stop breathing for at least 10 seconds. So it affects every major organ in your body if you have sleep apnea. So the first thing I do, obviously, is I screen for sleep apnea and I test for it and treat it. There's also a whole lab panel that I do. So I do labs for nutrition as well, and some of them are labs that you may not have had before because the primary care doctors don't do a nutrition analysis, right? So I'll do that, and I'll try to replenish the nutrients mostly with food or sun, vitamin D. But as far as sleep goes, there's specific things that I look at in the labs there that can cause some people to have a hard time falling and staying asleep and getting into their deep sleep.
Yeah.
So I kind of rule out a physiological reason for insomnia. So is it because you have sleep apnea? Maybe even narcolepsy, which makes you sleepy during the day so you can't sleep at night. We can test for that. And then also, for example, do you have a thyroid problem? Are you vitamin D deficient, iron deficient, magnesium deficient? There's a whole list of things I look for and treat. Assuming that all that's negative, or even if it is positive, we treat those things, then I do sleep therapy. And the positive thing about CBT-I for insomnia is it is effective 80% of the time in only 4 appointments. And honestly, for me, it's usually 2 or 3 appointments. If you're on something like Ambien and you want to get off, it would be a little longer because we'd have to teach you to sleep first. And then I'd coordinate with your prescriber at intervals of like 25% reduction every several weeks to get you off of it. But most people, it's not that hard. I mean, if people follow my instructions, I have people sleeping like babies, and that's huge. And I actually would start with sleep over food first just because it's so fast and because it also affects your weight. When you don't sleep, it slows your metabolism. So, I start with sleep when someone's really not sleeping well, and we do that first, and then we work on food. Because it's hard to work on both at the same time because there's homework. And nobody wants to feel like, she's making me. Yeah. I tell people, we can go at your pace. If you wanted to take a year, we could do that. Some people do this in 2 weeks. It's up to you. So I go at whoever's pace.
Gotcha. Yeah. Well, I love that because you're just meeting them where they are and what we can handle at one time. So learning everything that you've learned about sleep, understanding the techniques through CBT, like how has your relationship with rest and sleep changed over time?
Well, I've always had a touch of insomnia just because I'm very much of a type A person. So if I'm stressed about something, I would have usually a hard time falling asleep, but sometimes a hard time staying asleep. And so now I use the techniques on myself. And some of it is positive self-talk, as you know, as a therapist, telling yourself, I must not need to sleep right now. That's okay. I'm going to go read my favorite book, and when I'm sleepy, my body will tell me because I won't be able to keep my eyes open. And then I'll go ahead and crawl back in bed. So some of it is just learning some of the techniques and practicing it myself, and it works for me. And that's what I do, and I teach my patients that's just one example, but teach my patients how to do that. And once people know how to do that, it gives them the confidence to be able to sleep. So part of it is psychological, right?
Yeah, absolutely. And it's true. As a practitioner, whether it's in medicine or a counselor or whatever, we have to use these techniques too. We know they work because we use them ourselves.
Absolutely.
And if we tried to use them and they didn't work, maybe that's not one that we'll recommend for our clients because then we're skeptical.
Right.
So yeah, a lot of these are tried and true by the practitioners before we give them to our clients. So if we were trying to, we talked about some spices, we talked about food, we talked about sleep. If you're concerned about sleep and diet, start with sleep. If someone's feeling overwhelmed by just the information we talked about today and they're unsure where to start, outside of they should call you, what's one small step that you would suggest?
Well, with sleep, the first thing I ask patients, and it's crazy because this question has changed over 35 years of practice. So much. How much screen time are you getting? So 35 years ago, that was easy. Like, we used to recommend no more than an hour a day of screen time for a child, right? Now I have to ask most parents, how many hours a day are they not on a screen? It's literally that bad, right? But even adults too. And so first thing you need to start with yourself is, how much screen time do I actually have? I know at work many people have to be on a screen, but when you have a choice, can you get away from it? I'm trying to keep my phone locked up in my kitchen cabinet, after dinner. I actually missed an important phone call this morning because of that, because I didn't check it till I got to work. Yeah. I never have my ringer on, though. Really, almost never, because I don't like my phone. But, I try to use an old-fashioned alarm clock and not sleep with the phone next to my head. All those things are really important. And recognize, how much time am I getting outside? Can you take a 5-minute break at lunch and just get a little sun on your skin? Can you take a brisk walk? Can you take your child to the park instead of turning the TV on again? Like, what can you do to get a little bit more fresh air and exercise? That's going to increase your sleep pressure. That's going to help your vitamin D level. It's going to decrease your cortisol and your stress and your weight. It does all of the things. And then as far as diet goes, the first thing I start with is, how often are you eating food that you did not prepare? It could be takeout, it could be dine-in, it could be a vending machine. How often is that, and why? Do you just need to meal prep? Do you need to bring a snack? How hard would it be to make some air-popped popcorn at home and bring it with you? Grab a piece of fruit. Like, what could we do? Like, how can we make this easy and not expensive for you? So those are the two big ones from sleep and diet that I start with, because those are the two biggest problems I think Americans have. It's just being indoors on a computer and not moving and literally eating all foods that they don't make.
Yeah.
Yeah.
Which are then it's full of the chemicals
Yeah.
and all the other
Yeah.
things that are doing bad things to our bodies.
We don't know where that food's been, what they've done to it. Yeah.
Which is really scary.
It's
when you think
terrifying,
about
right?
it.
We just trust. We open a package or a fast food wrapper and
We
we
should be fine.
I know, we have no
All
idea.
the ingredients that we don't know how to read, but we're going to put them in our body. And I say we, me included. I'm not saying that about somebody else.
Right.
But yeah, I've definitely, like I said, the older I've gotten, the more I've looked at that and been interested in it in a way that I never was before.
Right.
Just because I know that it's impacting my health
Right.
to some level.
Well, you can even start with, could I go to Taco Bell instead of McDonald's because they have a bean burrito? I could get some beans, right? So it could be something that simple, like just make one little change. Like, if you're going to still do fast food, let's up it and get some beans in our diet. Or is there a place that you could get a salad or fruits and vegetables? Any kind of real food that is one ingredient food, rather than what you're eating now. So sometimes I start with those basic steps. And I even have adults that won't eat vegetables. We have to go to the cookbooks where they're hidden in the in this tomato sauce. But if that's what I have to do, I'm going to do it, because it's that important.
How can we puree this
Yep.
and hide it somewhere?
Yes. And any of my patients listening, I'm talking about you. Some of them. But yeah, some of my adults.
I do that with my children.
Yeah. And that's fine. I'm like, I don't care if you see it or not. As long as you'll eat it, it doesn't matter to me. So sometimes I have to do that. Not usually. Most people will eat vegetables, but there's some that won't. So.
Yeah, I gotcha. That's good stuff. So tell me, we're going to have in our show notes, I'm going to have links to all of Lauri's stuff because I don't know if you're convinced to make an appointment with her yet, but I am. Just sitting here listening to her. But Lauri, what's the best way for people to get in touch with you and come see you at your practice?
The easiest way is just to get on my website. So it's www.sleepanddiet.com, just like it sounds, SLEEPANDDIET.com. There you can make a free 10-minute phone appointment if you want to just ask me more questions, because honestly, I used to just try to do it at night and it was exhausting. So now if you want to talk to me, you got to make a 10-minute appointment. But I also take most insurances, really all the major insurances except for Medicare. I always say it backwards, Medicaid. Don't take Medicaid. I do take Medicare, TRICARE, United, Blue Cross, like all the major insurances I take. And I'm under primary care, so it's not usually a problem for billing. So that's kind of how the billing goes. I also, of course, take cash only and things like that. So that's the easiest way to get in touch with me. You can make a new patient appointment, which is a 2-hour appointment, or you can make a free 10-minute appointment and just say, hey, tell me what you can do for me.
Yeah.
Yep.
And then go from there.
Yep.
Awesome. That's wonderful. Well, Lauri, thank you so much for being here and taking the time to give us your knowledge on all of these things. There's so many more questions I have. But I want to leave you and our listeners, I always close out this way with a blessing from number 6, 24 through 26. May the Lord bless you and protect you. May the Lord smile on you and be gracious to you. May the Lord show you his favor and give you peace. You've been listening to The Merge, and we'll see you next time. Bye.
You've been listening to The Merge, hosted by LynnDee Horne. You can always find a copy and catch up on past episodes. Just subscribe to The Merge anywhere you listen to podcasts.